right, guys. So I'm so excited to have this conversation with Stephen Wilson from Solutions Pharmacy right here in Chattanooga, Tennessee. But the information that we're going to go over can help people all over the world. Thank you so much for being on, Stephen.
Thank you, Dr. Rebecca, for having me. I appreciate it. And it's an honor to be on your program.
Awesome. Well, listen, you're going to school me today. Like, I'm here to learn. I just want
You got
to
it.
hear your knowledge and your experience. And guys, this is going to be huge. But let's go ahead and jump right in because I have come across hearing LDN. I am on, just so you guys know, if you're listening, I need thyroid medication. I don't have a thyroid. So I went to Solutions Pharmacy to get compounded meds for me. And I saw this huge sign outside where you guys are doing classes for LDN. And I'd heard about LDN, about how it can help, but what is it? Like, what is LDN? How do you guys use it?
That is a great question. So naltrexone is a medication that was first utilized back in the 60s and the 70s for its effect on blocking the opioid receptor. Okay, so opioids are narcotic medications that are used for analgesia, for pain. So that's why naltrexone was developed. And so those typical doses for the naltrexone opioid blocking effect are typically 50 to 300 milligrams. Okay, so that's why it was initially used. It fell out of favor because it did truly block the opioid receptor, and it decreased the patient's need for or their addiction to opioids, but it did not address the withdrawal symptoms. So patients were having serious withdrawal symptoms from opioids, and there were a few deaths involved. So it kind of fell out of favor, used specifically for that. However, now naltrexone is used as a long-acting injection for the treatment of alcoholism, to decrease the desire for alcohol consumption by those people diagnosed with alcoholism. So given all that background, there were scientists in the mid 80s that found that using naltrexone, so a little bit of chemistry here, all chemicals, medications are present in nature in two different forms. So a left-handed and right-handed, they're mirror images. Mm-hmm. They're called isomers, and they're exactly the same, but their effects in the body can be drastically different. And that is dose dependent. So it depends on how much medication you're given. And it is also dependent upon the type of drug also. Mostly drugs that are right-handed don't have much of an effect in the body. The left-handed are more effective in the body. But at lower doses, naltrexone seems to elicit its effect on a different receptor. Okay, mm-hmm. So it's not the opioid receptor. It does still have some effect on the opioid receptor. So low dose naltrexone, we're talking, remember I said 50 to 300 milligrams is the dose for blocking the opioid receptor that it was approved for. Low dose naltrexone is anywhere from 0.5 all the way up to 16 milligrams. We typically see 4.5 milligrams is the highest that will go. And so at that doses, it blocks a receptor called a toll-like receptor, okay? Mm-hmm. So toll-like receptors are found throughout the body, and they're very important in the immune response. So the immune response in response to pathogens, inflammation, body, the body. I'll speak a little bit about inflammation later, but yes. So the toll-like receptor, particularly number 4, there have been 10 of them that have been identified in the human body. Some of them are inside the cell, some of them are outside the cell. but toll-like receptor number 4 is the one that naltrexone really appears to work well on, low-dose naltrexone. And through its effect on blocking the toll-like receptor number 4, it can decrease some of these inflammatory responses that you see in a lot of chronic diseases.
That is so. If you guys didn't understand any of that, what that means is that Stephen knows what he's talking about, right? Like we heard the history, we heard how it started, and I think it's really interesting to see how a medication used in a different way at a different dose can have such a completely different experience for people. Now, I asked you to come on because one of the biggest things, and we discussed this before getting on, before going live, is that, I work with so many women from all over the world at this point, right? Locally in Chattanooga and all over the world. And what I'm seeing, especially with the cytokine storm that can happen from COVID and even COVID vaccination, I'm doing a whole episode on both of those things and how it can create this kind of autoimmune storm in the thyroid. People are starting to get like these big symptoms, right?
Yes.
You can get hyper symptoms like increased heart rate, palpitations. A lot of the people that I end up seeing having these reactions end up in the emergency room looking for answers. They get their thyroid tested and they find out their thyroid is high. So my thing is, people know if they listen to me, I don't prescribe medication, but I know there's a time and a place. And if there's a way, something out there that's safe that can help someone decrease inflammation, decrease this kind of autoimmune storm, we got to talk about it, right? So how does that, because you mentioned inflammation, like how can LDN help with that kind of inflammation immune response if someone's going through that?
Sure. That's a great question. So, part of the inflammation is a good thing in the body. So it is part of the body's healing process. It's the part of the immune system or immune response that clears a pathogen or it, helps to heal an injury. And it's usually very tightly regulated. It's a complex mechanism to turn itself off once the injury or pathogen has been cleared. What happens is when that mechanism gets disrupted for some reason, and the inflammation process or pathway does not turn off, then you leads into chronic inflammation, which is at the very root of many of the chronic diseases that we see.
Yep.
And it's unbelievable how many chronic diseases that are related to inflammation, from cancer to diabetes to heart disease. It just really is a hallmark symptom of all these chronic diseases. So by utilizing, and I counsel my patients that LDN is not a typical anti-inflammatory, like it's not a non-steroidal anti-inflammatory like ibuprofen or naproxen, Aleve or Motrin. It modulates the immune response, the inflammation pathway. And you mentioned cytokines, so that's very important. Cytokines are released. Some are pro-inflammatory, which improve or increase the inflammatory response. Some are anti-inflammatory, but we're dealing mainly with the inflammatory cytokines. So when an injury or an infection happens, certain cells in the immune system drop these little chemical breadcrumbs. They're called cytokines. And it recruits other cells from the immune system to come, hey, here's the injury. I need you over here. And so they swarm to that site and do what they're supposed to do. Now, when you're dealing with chronic inflammation, those cytokines are out of control, right? You're getting a constant release of those cytokines. So one of the benefits, it's been shown that low dose naltrexone, by blocking that toll-like receptor number 4, TLR4, it can decrease some of the secretion or release of the pro-inflammatory cytokines. So that's a good thing because we've got chronic inflammation that's not being regulated by the body normally. So by turning off those cytokine releases, it can decrease inflammation systemically throughout the body.
Mm.
And you mentioned long COVID and cytokine storm and the problems that you can have with that. One of the interesting things that was found, everyone has heard of the spike protein on the
Mm-hmm.
COVID-19 virus. Coincidentally, it has been shown to bind to the toll-like receptor number 4,
Mm.
which, like I said, releases cytokines. So some of the symptoms, everyone knows someone who had COVID that seemed to be sick for a bit, seemed to improve their symptoms. And then within 2 weeks, they were back in the hospital on ice,
Yeah.
life support, ventilators, things like that. Excuse me. That has been shown to be a result of the cytokine storm. So it's a longer process,
Mm-hmm.
and happens over time. But the improvement of the patient and the sudden decline was related to cytokine storm. So
Mm-hmm.
if we can block that release of the massive amounts of cytokines, which are pro-inflammatory, then we can improve outcomes.
That is wow, that's really cool. Yeah, I know a lot about the spike
Excuse me.
protein and all of that, but not that connection there. And so if you guys are listening to this, like why this is so important for me, for you guys to hear this information is because most people, okay, so majority of thyroid issues, 90% are autoimmune related, either Hashimoto's, which is hypothyroidism, or Graves' disease, which is hyperthyroidism, right? And so with Hashimoto's, you can have low thyroid hormones, you can have weight gain, depression, anxiety, brain fog, memory issues, sex hormone issues. I mean, it slows down your whole entire body. Now, hyperthyroidism, like Graves' disease, you're having increased heart rate, increased just anxiety, feeling hot. You can lose weight. You don't necessarily have to. But I think the biggest issue is when people are being diagnosed with these problems. If you're being diagnosed with a thyroid issue, what I tend to find is that they either tell you, okay, you have a thyroid issue, get on some thyroid hormones, or get on a medication that kind of slows down or shuts down the thyroid for your hyperthyroidism. But they're never explained that if you have an autoimmune issue within the thyroid, it's an immune system issue, right? So there's that imbalance within the immune system where the cytokines also play a part, which is why people that have had COVID or do get that COVID vaccine can have this big response within their autoimmune symptoms, right? So for everyone listening, how does this all connected? If you have an autoimmune issue, it's the same type of thing that's going on there, that cytokine issue, that imbalance between Th1 and Th2. So if someone has, okay, like say someone has these long haul symptoms with COVID, or they have thyroid autoimmune issues, or just thyroid autoimmune issues that happened after being sick, or getting vaccine or anything like that, how can LDN help them? Like what would they see happen, and how long does it take to see something positive or something change within their body?
That's a good point. And you have mentioned in your previous um, radio shows that one autoimmune
Mm-hmm.
disease tends to lend someone into developing others because once your body does not recognize one type
Mm-hmm.
of cell as self, um, then your body is set up for other systems to be affected. So it is kind of a cascade. But so low dose naltrexone can help with by, like I said, decreasing the release of cytokines, and it kind of helps to modulate the immune response, right? So it's an immunomodulator, and it does so at the cellular level, and it does take time.
Okay.
So everyone's response is different. Like ibuprofen might work well for you, naproxen might work better for me. Everyone is different, so it's very individualized. We have seen patients that have a response within 2 to 3 weeks. And I will say that typically low dose naltrexone is started at a taper. So it's started incrementally, typically at 1 milligram for a period of time, up to 2 milligrams for a period of time. 3 milligrams, and the target dose is generally around 4 milligrams. So that usually happens over 4 to 8 weeks, that increase in dose. So we like to tell people, be patient.
Okay.
Just because you don't see any improvement within the first few weeks, you need to get to that target dose and be patient and allow that intracellular cascade to happen. And it's kind of how I counsel my patients that are on hormone replacement.
Mhm.
I tell them, it's a good thing that hormones don't work quickly.
Mhm.
You want them to be kind of the effects to be slow, because otherwise everyone would wake up and be in menopause.
Yeah.
It kind of happens gradually.
Yeah.
Um, so that's the same with LDN. You want to just be patient. We have seen patients that don't get a response until 5 or 6 months, but just know that the studies and just anecdotal responses that we've gotten from our patients is that the majority of patients do see some benefit in decreasing inflammation.
Now you said, an X amount of time before a patient sees a response. So what is a response? Like, how does someone know it's working? Like, what would they see? Like, what are they experiencing when LDN is helping them?
Sure. So low dose naltrexone is not a cure. It is
Mm-hmm.
first off, it is not FDA approved at the dosage that we're talking about. And doctors prescribe off label all the time for
Yeah.
for
Yeah.
everything. So different medications. So just because it's not FDA approved doesn't mean it's not effective. But they can see a decrease in symptoms and improvement in the disease progression. In other words, a slowing of the progression of the disease.
Mm.
And oftentimes, most of the time, patients can continue their normal therapy, whether it be for
Mm.
psoriasis or rheumatoid arthritis. They continue what they're taking, but they might see a decrease in their need for so-called breakthrough pain medications or topical creams if it's a dermatological immune autoimmune disease. They might see decrease in those breakthrough symptoms, and in the long term, what we're looking to do is improve quality of life
Mm-hmm.
for patients. Like I said, you're still going to have to continue your primary treatment modality, but hopefully, the need for different agents to be added on, because you see oftentimes with chronic diseases that you're just adding another medication, another
Yeah.
class of medication. So hopefully we're seeing a decrease in the need for that next class of
Yeah.
medication. Yeah.
Yeah, that's something that I read about when I was kind of doing my own research on it, was that kind of like to always, like, if you are on thyroid medication, to be aware that you
Mm,
may need less of it.
that
And
is
so a lot of
correct.
people will get like hyper symptoms while utilizing it and not realize it's because it's time to decrease the thyroid meds. It's not that
That
like
is
something
correct.
crazy is going on. So that is, yeah, I think that is huge too. I think that can be such a helpful thing for people that have thyroid autoimmune issues, because again, a lot of people don't realize that if that autoimmune issue persists and you get into this flare up and now there's attack, the tissue's being attacked, there's thyroid cell death, you're going to be not only symptomatic, but then you're going to need more and more medication over time
Correct.
if that immune response is going haywire.
That is correct.
So that is, I love that. Now, I am curious, is there someone that this would work better for versus is there a certain population that's like, okay, if you have this going on, maybe LDN is not a good choice for you?
Well, generally, we've seen, I haven't seen a particular, patient population. There are certain medications that respond better in women or males or certain ethnic group.
Yeah.
But this is, there aren't many, individual differences in the immune system as far as its functionality and the role that LDN plays in that. So from that perspective, there's not much interpatient differences in their responses. But like I said, every patient is different and their responses could be completely different. But it's interesting. You mentioned thyroid, and I suppose we'll talk more about that later. But yeah, that's an interesting point. Yes, so we'll talk more. I'll defer
Yeah, no,
to
let's
you.
talk about it now. Like, what are
No,
you
no,
thinking about that in regards?
no. So yeah, so you mentioned and mentioned in previous radio shows that a vast majority of hypothyroidism is treated with levothyroxine
Yeah,
T4.
yeah,
And that's been the standard of care, and
yeah,
doctors are trained on that for
yeah.
years. Um, but the vast majority, and I've heard up to 90% of patients suffering from hypothyroidism, it's related to an autoimmune disorder,
Mhm,
Hashimoto's.
mhm,
So, as we just talked about, if we can decrease uh, the effects of an autoimmune disorder,
mhm.
then you might improve outcomes, decrease the cell death in the thyroid,
Yeah.
um, and decrease the need for thyroid supplementation. So, um, they're kind of doctors now, practitioners are really throwing an old,
Mhm,
kind of outdated, and you've gotten into lab work, lab tests
mhm.
as well,
Yeah.
and you're spot on. But they're throwing something that's not quite effective at a problem, and that's why a lot of females and males with
Mhm.
hypothyroidism are not seeing symptom relief at all because they're
Yeah.
not addressing the underlying issue, which 90% of the cases, up to 90% of the cases, can be an autoimmune inflammation attacking the cells of the thyroid.
Yeah. Yeah, I think that was the thing that like frustrated me the most when I started working with so many people years ago is that number one, we know with studies that if that immune system continues to run haywire, be imbalanced, that attack going on, not only does it destroy thyroid cells, but it increases your chances of thyroid cancer,
Yes.
especially if you have high thyroglobulin antibodies. And I was a patient, right? Like I
Mhm.
actually I'm actually still Facebook friends with my first pharmacist because we would
Oh,
talk. I always asked questions. Like I just announced my pregnancy and he like congratulated me. I'm like, oh, it's Sharif. Anyways,
that's
but
great.
I always asked questions because I was always so curious. But it was so wild to me that when you get on thyroid meds, you think you're getting the problem taken care of, right? So you're like, you even might even start to feel better, but you're not. Like you feel better, but the underlying problem is still there. And especially, I think, and I think you can even talk to this as well. I hate it when there's those flare ups with the thyroid autoimmune issues because it can be so hard to control, where you feel like hyper one day and then hypo to the other. You might have difficulties like swallowing one day and then you're tired the other. So when you do have that flare up of autoimmunity, you think, what is going on? Your doctor might know you have an autoimmune issue, but it's never being addressed.
Sure.
Now, with that, when we're looking at that, I did see something and I was curious to see if you've seen this as well. I was reading about how the inflammatory, like, kind of response and how LDN can help. How about like increasing cell receptor sensitivity? Do you know anything about that? Like how
Absolutely.
that comes into play as well?
Absolutely. So LDN, particularly with thyroid, has been shown to increase the absorption of thyroid hormone into the cells, which is where we need it, right? So
Yeah.
it floating around in serum, it's not doing what it's supposed to. So it improves the absorption of T4 and T3, also helps the conversion of T4 to T3. Um, but
Mhm.
yes, and you know, by decreasing the inflammation and cytokine production, it can normalize immune abnormalities, And you talked about flare-ups. So,
Mhm,
day-to-day life can
mhm,
cause cortisol release due to high stress or injury or sickness. Other other concomitant other diseases that the patient might have might also contribute to that as well. But the cytokines are released in response to it could be physical stress, emotional stress,
mhm.
other mental situations that you're going through on a daily basis. So you can see these fluctuations in your day to day. How do I feel?
Mhm.
And it's really it can be based on your environment, what's going on in your life at the time. And so, and
Yes.
everyone living in 2022
Yeah.
has stress going on in their life.
Yeah.
It's just a part of what we do as Americans. But so that's a whole nother topic we can address later. How to
Absolutely.
de-stress, declutter your life.
Oh my
I
gosh.
need that myself. But
Amen. Same.
yes, but specifically for the thyroid, low dose naltrexone has been shown to improve that absorption into the cells,
Mhm.
um, and also decrease the conversion of T4 to reverse T3.
That's
Uh,
cool. That's a big
yeah,
one.
yeah. So reverse T3 is not necessarily helpful for you. It's not
Mm-mm.
necessarily harmful, but it's not what you need to function normally in a euthyroid or normal thyroid state. So uh, low dose naltrexone in the hypothyroid patient has been shown to improve these functions in the thyroid system.
Now, you made me think of another question. How about like with Graves' disease? Do you see
Mhm.
that it can be because it's either usually with Graves' disease, and I feel for people that have this, and I feel bad because people are always like, everyone talks about hypothyroidism. What about hyper? And we are going to see that a lot more with all these stressors that we're being bombarded with. So, do you see? Because right now, pretty much the only option is it methimazole, where you can like shut down
Yes, absolutely.
or get it radiated, right? So pretty
Right,
much either one is shut down the thyroid and then
right.
eventually need thyroid meds.
Supplementation, right.
Yes. So how about having that hyperreaction? How can LDN help that? Like, does it help kind of keep it under control, or is that a good option
It
for them?
does. That's a good question, a good point, because a lot of the focus is on hypo,
Yeah.
but there is a percentage of the population that
Mm-hmm.
deals with hyperthyroid or thyroidism, and that's what we tend to call Graves' disease. Excuse me.
No worries.
Graves' disease is an elevated thyroid stimulating hormone, uh, immunoglobulin, right? So it's an autoimmune disease where
Mm-hmm.
an antibody that mimics this TSH is released. So when you have elevated TSH, um, it can lead to hyperthyroidism because it's the pituitary gland is telling the body, the thyroid gland specifically, that I need more thyroid hormone secreted. So not only do you have your endogenous or in your body normal TSH being released, but you've got an antibody floating around that mimics that TSH. And that is an autoimmune disorder, right?
Mm-hmm.
So that antibody that mimics or sits on the receptor of the TSH on the thyroid gland um, tells the thyroid gland to produce more thyroid hormone, causing this hyperthyroidism state that has its own set of concerns. So by addressing um, the immune response, right? So we're talking about, and again, these are cytokine related. All goes
Mm-hmm.
back to inflammation, right?
Mm-hmm.
So you have to take that into consideration. You have to address the out of whack immune response, right? Because your body is attacking its own cells. Um, and or it's producing antibodies that mimic a response naturally found in the body. So low dose naltrexone can help with that release of the um, uh, thyroid stimulating immunoglobulin, which mimics the TSH. So yes, it can be very effective in Graves as well.
Oh,
We just
that's
don't see it as
awesome.
often.
No,
We
you
don't see it as
don't.
often as hypo.
No, yeah. Well, that brings me to my next question, right? Because I have brought it up, right? I've said, hey, you might be a good candidate for LDN, speak with your doctor about it. And then they'll come back and say, my doctor doesn't even know what this is or how
Exactly.
to use it. So for someone, so you guys first, before you explain, like, how do we bring up this conversation? How do we find a practitioner? And I know we touched on you guys. So you guys are here in Chattanooga, Tennessee, but you work with other states. How about you give us that? Like, give us like the applicable. If someone wants more information, what should they do? If their doctor doesn't know what to do, how should they start that conversation? And can you guys help them, even if they're out of
Absolutely.
state? Yeah.
Absolutely. So early in, I guess late 2020, you know, Angie Field and the marketing director and I were talking about low dose naltrexone, and we had a few patients on it, a handful. But one of the best resources that I've found on the internet is LDNresearchtrust.org. And that is a foundation that's established in the United Kingdom. Linda Ellsgood is the conservator of that trust. She's also an author of a few books on LDN, but they offered some continuing education classes. So we took those, and Angie actually took the master class. I've yet to do that, but and so she became an LDN specialist. And she's a certified pharmacy technician as well as our marketing director. But so we became passionate. So we developed a program that, because like you said, doctors hear naltrexone and all they think about is opioid
Opioids, yeah.
antagonist. Yeah,
It's like, why are you asking me for this opioid
exactly,
drug?
exactly.
Thyroid issue. Yeah.
And to no fault of their own, it is
Yeah.
off label, and it's like we talked about earlier. It's a different mechanism, and it's used for a completely different set of disease states, but at the lower doses. So, doctors do not have an idea what's going on. So it became our mission to educate first the local doctors here, and so we at Solutions Pharmacy on Little Debbie Parkway in Ooltewah, we have been a compounding pharmacy for been around for 60 years. We've been compounding only since 2003, but so we decided to hold a seminar every the first Thursday of every month. I give a talk, and it's for lay people. Last Thursday we had two doctors and their wives came, and so that was encouraging. One was an OBGYN and the other is
Awesome.
an internist. Yeah, at a large medical group in Chattanooga. So
That's awesome. Yeah.
yeah, it's good to get the word out, and we've done
Yeah.
some lunches. We've got a meeting Monday night to talk to some mid-level practitioners, some nurse practitioners, about hormones in general, and we'll talk about low dose naltrexone to them. But it's just getting the word out there. So if if your doctor, if you're interested in pursuing this and seeing if it might be right for you, we're willing to talk to you about that and see if it might be a fit for you. And also, we'll kind of coach you how to talk to your doctor. A lot of times, they don't have time to do the research, or they're unwilling, or for whatever reason. But if we have established that line of communication with the practitioner, um, more times than not, because there are low drug interactions with low dose naltrexone. There's low side effects, adverse reactions. It's low cost. It's cost effective. Something that we compound by prescription, pursuit to a prescription for a specific patient. in our pharmacy, but we're willing to have that conversation with the provider to talk to them, talk them through it. And we do have a number of providers that are accepting, new patients that would be willing to prescribe LDN for any of your patients or listeners.
That is awesome. That is really
Yeah.
awesome. So one more question here that I do want to ask. So what are kind of like the list? Because that's what caught my attention when I went to Solutions Pharmacy, was like this banner.
Mhm.
That good job on the banner, because I was like, oh, interesting, right?
Yes.
So of all the things that this could help, and so I have a lot of listeners as well that have gone through thyroid cancer. They have had their thyroid removed. And so the one thing I always teach them is that just because you remove a sick organ doesn't mean everything is fixed. That organ was a symptom of a body that wasn't well. And so a lot of people don't realize, I didn't realize for 7 years post thyroidectomy that I still had to heal my body, had all these toxicity issues. So this can still be helpful for someone if they had an autoimmune issue that led to thyroid cancer or thyroid growth. So for those that don't have a thyroid, or maybe those that don't even, think they have an autoimmune thyroid issue, what are kind of, we talked about long haul COVID, what are some other symptoms, some other things like symptom wise or, diagnoses wise that people have gone to you guys or gone to their doctor for LDN?
Absolutely. So the list is absolutely extraordinary, and I for a comprehensive list, I will refer to that ldnresearchtrust.org
Okay.
because they have a
Okay.
great drop down menu, and articles concerning each disease state. We've seen patients from fibromyalgia,
Wow.
rheumatoid arthritis, um, multiple sclerosis, thyroid disease, of course, we talked about. We had an OBGYN ask about infertility and low dose naltrexone. There are articles out there about that. We've talked to people about post traumatic stress disorder. Of course, all of the eczema, psoriasis, psoriatic arthritis, things like that. And then also just general arthritis because we're dealing with an inflammation.
Inflammation. Yeah.
Yeah, pain, unspecified pain that's not controlled. Or if you have a patient that's consistently taking NSAIDs or opioids, and they want to come off of that, then there's the ability to add low dose naltrexone. If the patient's taking opioids because it is an opioid blocker, that's a whole different discussion. You have to use what's called ultra low dose naltrexone,
Mhm.
and work with the pain management provider to help. But that has been shown to help patients with chronic pain to back off some of those opioids that they're taking, which is the goal of pain management. So the list is exhaustive. I mentioned earlier all the disease states. Cardiovascular disease has an inflammatory component. Diabetes, juvenile onset, or type 2 diabetes for that matter. The list goes on and on about the systems in the body that are affected and chronic diseases that can be tied back to inflammation. And because this doesn't work, LDN doesn't work necessarily on one organ or one body
Mhm.
system, it works at the cellular level on the immune system, then it can help a broad range um, of disease states, of symptoms, because it kind of gets back to the basics. What is causing this disease ultimately, and more often than not, it tends to be
Okay.
an inflammatory comment.
Okay. So I said that was the last question, but I do have one more question as we wrap
Sure.
up here for the um how about if people want to get on it, what does it look like if they wanted to come off of it? Is this something
Yeah.
like anything to know about that or
No. No. So um, I I do tell patients. So when we start that, we have a range of things that we counsel patients on. First and foremost is to be patient
yeah.
with their expectations, temper their expectations. But I do mention to them, that if they're going to have a planned surgery that would require pain medication, opioids, then to stop 7 days prior to that, just to be safe, so that the opioids will be able to effectively work. But no, there's no withdrawal symptoms or anything like that.
Yeah.
There's no negative outcome if you just stop. Taking it. So, if you do have unwanted side effects, common side effects that we will hear about, a little bit of nausea, a little bit usually subsides in a couple of days, and these can be upon initiation or increase to the next dose. Vivid dreams, or
Okay.
not necessarily nightmares. I
Yeah.
like to compare it to when the color comes on The Wizard of Oz. That's kind of,
Yeah.
and it's usually usually 1 or 2 nights. And I had a patient say, "I'm looking forward to those vivid dreams," and I was like, "Well, I hope you have them, buddy."
Oh
So
my gosh. Yeah.
yeah, but or maybe a minor headache, but really that's about all that we hear about. And so, yeah, there aren't a lot of patients that discontinue the medication because of side effects.
Okay.
We might have patients that discontinue because they've just given up on it, but I would encourage patients to at least give it 3 months of the target dose, 3 to 4 months if they can, to
Okay.
see if they can get some benefit.
Well, awesome. Thank you so much. I am going to make
Thank
sure
you.
to add all of y'all's information, the link that you talked about here in our show notes. I know this is going to be, I know this is going to be helpful to so many people, but it's going to be an amazing resource for me because I get asked this question all the time. And I'm just going to send them this link. So thank you so much, Stephen.
Thank you, Dr. Rebecca, for having me. Thank you for what you do for our community. I appreciate you.
Absolutely. Thank you.
Take care.